It's like breathing through 2 coffee straws. It's really hard to take a breath in.
I got so I couldn't do anything. I couldn't figure out what was wrong with me.
Then it got to where I would eat small portions because if I got full, I couldn't breathe, even though I was on oxygen 24/7. So I stopped eating.
I was supposed to die. There's no way I was supposed to be alive right now.
He said, "You know how bad your lungs are?" I walked in there and I said, "Oh, no, not really." And he said, "Well," he said, "you're in bad shape, you know." I said, "How long do I got to live?" And he said, "Maybe 6 months."
I was on death's door. I was on death's door.
Welcome to the lung transplant program at Norton Thoracic Institute at St. Joseph's Hospital Medical Center. I'm Dr. Rajat Walia. I'm the medical director of the lung transplant program. The first consultation they have with us is all about educating them. First, talking to them about their disease, whether there are the treatment options available, everything's being done, or transplant seems the only viable option. And if it does, then the first meeting they have with the transplant nurse coordinator and the physician is all educating them what transplant is all about. They hand out educational materials, resources, and throughout their evaluation and testing, that information is repetitively given to them so they really have a good understanding of what they're in for from a medical standpoint, emotional standpoint, financial standpoint. They have extensive interviews with our social workers, psychiatrists, financial counselors, in addition to the medical and surgical team. They also undergo a lung transplant education class, which is conducted by a lung transplant coordinator. So we put a lot of work into the front end, educating the patients, because once they go on the transplant list, they will be transplanted quickly at our center, which is a big differentiator for our program.
Hi, I'm Brandy Krushelniski. I'm the Senior Director for Transplant Services at St. Joseph's Hospital. Normally, a wait time for a lung transplant can be anywhere from 6 months plus. We're very fortunate at our center. We're an aggressive center and our wait list is very short. We have patients who are listed as short as 12 hours to patients who have been listed as long as 6 months plus. And that's an outlier for us because they usually have some antibodies or a blood type that's challenging to match with a donor. But from a donor perspective, when that donor becomes available, we usually figure out a way to manage that donor to make it acceptable for our patients.
We work up the donor, make sure the donor is appropriate, blood type, size, good lung function, and then if it looks good, we involve our surgeons. The patient goes in for transplant surgery, and then the transplant pulmonologist goes into the operating room and involved in the recovery.
My name is Kathy Lamb. I'm one of the clinical social workers for the transplant program. My job is to gather social history, learn a little bit about the patient and their family, and educate them about the social requirements for lung transplant, which is their housing needs, their transportation needs, insurance, income, and most importantly, caregiving. These are all the requirements that every patient must have in place in order to be a candidate for lung transplant.
Everybody is accountable for what they do, and not only just in words, but in the way they do it. They're passionate about their work. They know that their part is vital to making this transplant happen. So whether it's the social worker who's trying to find the patient somewhere to live, or whether it's the RN coordinator who's trying to make sure that the patient understands all of their medications before they go home, or whether it's our transplant pharmacist who is ordering the medications to make sure that they understand the side effects and the finances that go with that. We have a financial coordinator that our patients are aligned with and that they work with for their co-pays and what will their responsibilities be in each phase of transplant.
it's nice when patients send us pictures and videos when they go on vacation, 6 months transplant, they're hiking up a mountain, or they were in Colorado at 7,000 feet where they've not been able to go for the last 5 years. It's very rewarding to see patients and their families being able to live normally again.
It took me about 5 years before I decided to get this transplant. And it took me dying to realize that I really needed it. If you're gonna do it now. Because if you wait till the last minute like I did, you may never get another chance.
It ain't no piece of cake, but you know, it's worth it. Look at how blessed we are. Most people don't get a second chance, you know. And the people that give me my lungs, and they go right on down the line. You know, I mean, they give me another chance at life.
I thank God, my donor, my family, and my extended family. My extended family is everybody here at St. John's.